Hello guys, welcome back to my channel. Marcy is currently napping. Like, he is just snoozing away. I'm gonna do a little Q&A type video. I am by no means giving anyone medical advice. I'm literally just gonna tell you what works for me. I feel like it's really hard for women to find information on loss and miscarriage and realize like how common it is. So I had Marcy in February of 22. Throughout my whole pregnancy, it was pretty normal. The very beginning, I had a subchorionic hemorrhage. My doctor basically told me that your body can either like absorb it and you won't even know you had one, or it might it might come out. So I had that in the beginning. Nothing happened. I guess my body just absorbed it, went on, and pretty much through my whole pregnancy, it was normal. Up until like the end, I think my blood pressure got sort of high, and then I was like monitored because of my blood pressure at like 30 something weeks on, and they decided to induce me at 37. And then at 37, I had Marcy. Everything was great. Delivery was great. I had the best nurses, everything. I remember my doctor, like after I had him, whenever I was going to deliver the placenta, she was like, Haley, your placenta was like aging, like it doesn't look right. So I remember her saying that, but like not really knowing what it meant. And anyways, delivered it, went on with our life. Then fast forward to this last year, 2023, Marcy turned 1. We were like, okay, we want our kids to be close in age, so what if we start trying? When we tried for Marcy in 21, we didn't have any problem getting pregnant once we started tracking it, if that makes sense, like tracking when I was ovulating and things like that, because there's really only like a few days in your cycle which you can like actually get pregnant. We started trying in February, March, I would say April, so a little after he was 1. Got pregnant in April, and then I remember it being like, I didn't really have a lot of symptoms, but I really didn't have any symptoms with Marcy either, which I guess they say when you're having a boy, like you don't really have like a ton of symptoms, or I don't know if that was my case when I had Marcy. Like I wasn't nauseous. I had like food aversions and I would get headaches, but like that was it. When I got pregnant in April, I didn't really have a lot of symptoms, but took a test, was positive. Everything looked great. Went to call my doctor, and my old OB, they didn't see you till like 8 weeks. When I was like 7 weeks is when I had a lot of bleeding, like a lot. And so I was like, something's not right. I know something's not right. Like this never happened with Marcy. I did blood work, and I think we did blood work, and then I went back 2 days later, and basically if your HCG is rising and like doubling every 2 days or every day and a half or whatever, then that's good. That means you have like a good pregnancy and everything's like growing as it should. But if it's going down, it obviously means that something's not right. You could be miscarrying, whatever other reasons it could be. My numbers were going down, so we knew that I was miscarrying. If you don't want to hear about any of this, fast forward, or like don't watch this video, I guess. But I'm not going to go into like details, but I'm going to just explain what happened, just in case anyone's ever going through that. I literally had no idea what was happening. I had no idea what I was going to go through, anything. So when it was happening, it was all really scary to me. So if this video can help someone feel less alone, and I honestly feel like I'm gonna cry right now, like thinking about what happened, but if this is gonna help anyone, I'm glad I'm making it, because the amount of messages that I got after I posted about my first and my second miscarriage were like so kind, but also like the amount of messages that I got were like unreal. Like I wouldn't say like 30 to 40 people messaged me, like, you know, saying that they had had one too, and like how hard it is. So it made me feel better. I mean, that sounds awful to say, that I know that I wasn't alone, but like I feel horrible that all those people had to go through that as well. But it made me feel better knowing that I wasn't as alone. So basically what happened is I just remember getting like a cramp in my side, and it like did not go away, and then it just like escalated from there, and it almost feels just like you're having like a cycle, like you're like having a period, but it's like super heavy, super clotty, and you just like pass a lot of clots and everything like that. So that's what happened to my first one. They did blood work after to like make sure that my HCG and everything went back down to 0, and I remember them saying that my progesterone was really low. And when I nursed Marcy, I nursed him for like a little over a year. And they say that whenever you're nursing that your progesterone can get really low. Had I known that, I would have maybe like figured out a way to like get those levels to rise before I started trying again, but I honestly had no idea because I had only had one baby and I had never nursed, and I didn't know that all of these things like could affect you having a child. Because whenever I talk to people, some people were like still nursing and they got pregnant, had their other baby, and like still nursed throughout their pregnancy. So I did not think any of that was like related, but it was for me and my body. But everyone's body is so different. They were like, since your levels were low, we're gonna prescribe you oral progesterone, and you'll like start it when you know that you're pregnant or whatever. So we got pregnant again July of 23, and same thing kind of happened. Not really a lot of symptoms. I did take the progesterone, but when my doctor had me come in as soon as I found out I was pregnant this time, and they took my blood to check my like levels, like my progesterone and all the other levels that they check. HCG looked good, progesterone was low, and she was like, just make sure you're taking that, and we'll come back in a few days, test it again, make sure your HCG is going up and your progesterone is also going up. Came back in a few days, my HCG was going up, but my progesterone I think was like at the same, and she was like, as long as it's like, I don't really remember what my exact levels were, but she was like, as long as you keep taking it, they should rise. To get to 7 weeks again, it was literally both times was at 7 weeks on the dot, like exactly like when I turned 7 weeks, I miscarried both times. What they did is called a recurrent pregnancy loss test, and what they test for is like autoimmune disorders, insulin resistance, diabetes, and other things like clotting disorders and things like that that could cause you to miscarry back to back or like multiple times, which I was hoping that those test results were going to come back normal, because I had a completely normal pregnancy with Mercy, and well, completely normal to my knowledge. Anyways, everything was completely normal. Like all my blood work looked great, all the autoimmune came back negative. The one thing that came back was that I was positive for factor V, but I was only heterozygous, so I only carry one of the like genes, if that makes sense. So what factor V is, let me read it to you. Factor V is an inherited blood clotting disorder due to a mutation of the blood factor V protein. It increases the chance of clumps and blood clots developing, which can be life-threatening. Women with the disorder risk developing blood clots during pregnancy or when taking the hormone estrogen. And it says that treatment can help, but it can't be cured. So basically it can cause you to have more clots in like your legs or your lungs, and which is like crazy to know that I went my whole first pregnancy without knowing that I had that, knowing that I could have literally been at risk for a giant clot in my lungs. And they say that your percentage or your like likelihood to clot after you have a baby is like a lot higher, like postpartum. And I'm just so thankful that everything pregnancy-wise and postpartum the first time went so well, knowing that I had this. So fast forward to now, I switched to a new OB. I wanted just someone that I could talk to, that I could like, I don't know, I feel like with my old OB I was very rushed and not heard and not told what was happening, and I don't know. I think when you get a doctor, you really just want one that you're gonna like click with and be comfortable with, and my new OB I love. She's so kind, so easy to talk to, and I met with her before I even got pregnant this time. I never know if to call it like my second time, even though it's like my fourth time being pregnant, but it won't be my only second like pregnancy, if that makes sense. Anyways, before I even got pregnant again, and I met with her and I talked to her about everything, and she told me like all my options. She was like, you can start on baby aspirin, you can get on the Love Knock shots, which is basically like a blood thinner, right when you get pregnant. You don't have to, but you can. I guess your risk of like developing a clot with the heterozygous gene is like slightly higher than the normal person, but it's not like crazy higher. And she was like, that could have been why you're miscarrying, could have also been your progesterone, it could have been a combination of the two causing like your blood to clot and your levels be low, and it just like wasn't an optimal time to be pregnant. So all that knowledge, I took and I went to a fertility clinic in Houston, and they basically took my blood and Ross's blood and they did a genetic test, because I never had that done at my old OB, and they basically tested for so many genetic disorders. I don't even know how many it tests for. So basically it comes back if you're a carrier of them. It doesn't mean you have them, it means like you're a carrier of them, and they're all recessive. So I think I was a carrier of like 2, and Ross was either a carrier of 1 or 2. And basically you just don't want to be a carrier for the same recessive disorder, because then your kids will have a 1 in 4 chance of developing that. And the 2 that I had were like, when I googled what I had, I was like terrified. I was scared. I was like, I swear if like yours come back, like I'm gonna like freak out. Anyways, they came back and we were not a carrier of the same thing. Praise Jesus. So that wasn't an issue. They were gonna see if like maybe that was a cause of like why I was miscarrying, or what it could be. And they basically said that whenever I got pregnant again, I can either be monitored by them or by my OB. And I just really was looking for more answers, because at my old OB I wasn't getting the answers that I was wanting. I was wanting to know what I needed to do differently, what I needed to do like supplement wise, if there was anything I could do, like all these things. And I feel like Ross and I are like relatively healthy people. There's literally like not a lot of things that make us super unhealthy, and we try to eat healthy for the most part, but it was just so frustrating knowing that. So all that to say is we got pregnant this time. I started the baby aspirin before I was pregnant, so I was on the baby aspirin since I talked to my new OB and my fertility doctor, and I was taking that daily. Basically it's just like making sure your blood doesn't clot, so like even when Ross and I were to get pregnant, like there would be no clots forming in the beginning, if that makes sense. So I was on the baby aspirin, I was on the prenatal. What else did I take? And then once I found out I was pregnant, I did start the Love Knox shots. So let me answer your questions now that I've been rambling for like 21 minutes. One of the questions was, did I do anything different this cycle than I had the other 2? And it was the baby aspirin. I wasn't on baby aspirin for the other 2 cycles, but this one I was, because it was recommended by both of my doctors, my new OB and my fertility team that was watching me. And they were basically like, it will just improve your chance, like it won't hurt anything. So that's something that I was taking that I didn't take the other 2 times. Another question I got was, in my first pregnancy, did I prepare my body with supplements like prenatals? Yes. And I forgot to mention that when my like blood results came back from the panel that they ran all the tests from, my recurrent pregnancy loss panel, they found out that I had the MTHFR gene mutation, which means that like my body can't process folic acid. Let me read it to you so I'm not like spreading false information. So the MTHFR gene mutation, basically you can't process folate, and there's like a bunch of different things it can mean. This is just my understanding. I could be completely wrong, so don't take my full word for it, but basically it's how your body processes it. So if you're not taking the right prenatal, which they have so much folic acid in prenatal because it helps the baby's like spine and brain and things like that develop, but you basically want to be taking methylated folate. I don't know if I'm saying that right either, but let me get my prenatal that I'm taking out and I'll show you. Here's the prenatal that I'm taking now. It is the brand Zoller, and basically it has, I basically looked up best prenatal to take when you have the MTHFR gene mutation, and so instead of folate it is metha whatever something. It's basically biofolate. It's basically like, I guess, broken down better for your body. So this is the prenatal that I'm taking. It's awesome. You take 2 a day, and I literally am just taking baby aspirin. It's like 81 milligrams baby aspirin, 1 a day. Okay, a lot of my questions were about my shots. So I'm not on any hormones like estrogen or progesterone or anything like that, or anything to do with like IVF or IUI. We didn't do anything like that. We were just basically covering our bases as far as factor 5 and the MTHFR gene mutation and my progesterone this time. So what we are on are these shots. So the Love Knox shots, these that I take once a day, are a blood thinner used to prevent blood clots that are sometimes called DVT, deep vein thrombosis. I take one of these a day. So basically, in my first video where I'm taking them, it's literally, I just watched my video of telling Ross and then us doing the shots for the first time that night, and I was like laughing at myself at how dramatic I was being. And it wasn't dramatic. I'd never done a shot for myself or had Ross do a shot for me in a day in my life, so it's all fair. Anyways, you squeeze like a little bit of your stomach and you pop it in there, you squeeze it, you take it out, and you're done. And I would need to like sterilize it before, but I do it literally by myself now. Ross used to do it for me all the time, and I think it's different having someone do it. Also, it's like not medically trained, not that you have to be, but like I feel like knowing like when it's going in and all of that just like helps me better, like to be in control. I don't really have any side effects other than I'm cold all the time. I used to be hot all the time. I don't know if that has anything to do with me having factor 5, but or if I was just hot natured. But anyways, the blood thinner I read can make you like a lot colder. Like I used to sleep with it like on 68 in the house and it would be perfectly comfortable, and now if it's on like less than 70, I'm like shaking. I'm not kidding. I'm not even being dramatic. It is so cold. Another question I got was any tips on how to let yourself be excited when you find out instead of being scared. And I don't think I have a lot of information on how to be excited other than trusting in Jesus's plan. And I know that those other 2 babies that I miscarried are up in heaven, and that makes me excited to be in heaven one day and meet them. That makes me want to cry. But that is how I tried to look at it, was that if it was meant to be this time, it was basically going to be meant to be. And I just had to trust his plan. And so I just tried to be as excited as I could, knowing that there was a different path that we were taking. Other than like the first 2 times it happened, we didn't really change anything. So if it was going to be different the second time, I was going to kind of like write that first one up as a fluke. And whenever it happened the second time, I was like, okay, we need to change whatever's happening. Okay. But that's how I would be excited, even though I was still really scared when I found out, but I was also really excited. Another question I got, are you on the progesterone shots or what do you want? So I'm not on progesterone anymore. So basically, since my progesterone was low, they had me on a progesterone suppository, which means basically you put the progesterone onto this little suppository applicator and you pop it up there and you let it do its thing. And it was like at night I would do it. I think at one point my levels were great this time, because I don't know if it was attributed to that or what, but I think at one point they were kind of like not dipping but like not rising as they should, so they upped my dosage to twice a day, and so I would do it like every 12 hours. But that was only for a few weeks, or like a week or 2, and then once you get to 10 weeks your body takes over like making progesterone. Like I don't have to do it, like the placenta's doing it, so I'm no longer on that. So those are literally the only 3 things I'm on now, are the baby aspirin, the prenatal, and the blood thinner shot. And then I am on like this methylated folate. I don't know if I'm saying any of this right, but I'm on that because they prescribed it to me at my fertility clinic. Also, a question I got was about the fertility clinic and what did I do there. So basically they didn't do any fertility work. They just did my blood work and they monitored me once a week once I found out. So when I found out, I was like 4 weeks. Another question I got was, how did I track my ovulation with a thermometer or strips or things like that? I did not do the thermometer, but I did use the Easy at Home, the Easy at Home Pre-Mom kit. So basically here, I'll show you. So there is little blue strips. The blue strips are the ovulation strips, and you open it up and it's like a little strip, and you can either pee into like a little cup or pee on the strip. And I bought these like little tiny cups on Amazon. They're like I don't know if I have any left, but they're like little, like tiny little plastic cups that you can like go to the bathroom in, and then you just dip it and it's like less messy, because that was my preferred method. Okay, so this is like a screenshot of someone else's. So basically, those, you'll like log pictures of your strips. So on whatever day it is, like you'll go to the bathroom on the strip, and it's kind of like a pregnancy test. Like if it's a really light, you're probably not ovulating that day, but you take a picture of it, and it like does like a numeral amount for how much you're ovulating, or like what your percentage of whatever this is measuring. And so you do it for like in between when you start your first period, or when you start your period, and when you're about to start your next. So I would start it like a week after I was done with my period. I would start these, and it would basically tell you when it's your peak. And when it tells you it's your peak, it looks like this. And once again, this is from Google. So it would say like you have a high chance of getting pregnant. Your ovulation is either today or in one day, and you know that that's your like day to make it happen. Okay, so those are what those strips are for. And then it also comes with like pregnancy tests. So they're the like pink ones. And there's not as many of these, which I guess is good, because they hope that their other strips, I guess, are doing the job. But then you can use those other strips to test like right when you think you're gonna find out, instead of buying those really expensive tests that are like $15 to $20 a piece. So I would always use those, and then if I really was unsure, I would go and do the other test. Another question I got was, what other supplements did you take? Okay, so there are a lot of supplements that I took, and I don't know that any like super worked. So I took this oil called Prove, or you don't take it, you apply it. Let me show you. My friend recommended this to me, and it's like a topical progesterone that you basically, that before I was trying to get pregnant, so after my second miscarriage, I started this, and I would put a little on my arm or my hand like once a day, and it basically like helps your hormones and your progesterone levels like level out and get right before you start your next period and before you try again and whatnot. So I did that. I also took beef liver, and it helped with a lot of things. I noticed my energy was up, but those two I think really helped me not get pregnant, but like get my body back on track to get pregnant, if that makes sense. So I'm not taking any of that anymore, just what I told y'all. But yeah, a lot of my other messages were from moms that had similar things happen to them. Many people sent me such good advice and things to do and like what worked for them, and I really attribute a lot of mine to Jesus. And trust me, it was hard. There were like days where I was like so confused as to why bad things happen, and when you see all these other people getting pregnant and some people that don't even want to get pregnant, or just so many different things, you wonder like, is it even gonna happen again? There's just so many things that go through your mind. And then there's times where I did struggle in those months in the summer. I wouldn't say I struggled with my faith, but I struggled with my faith in his plan. I think also your hormones are like this as a woman always, but when you're miscarrying and you're pregnant and you're miscarrying and you're pregnant, your hormones are just, they're on a roller coaster. I hope this video has helped anyone, helped you feel less alone, given some more clarity, questions to ask your doctor, tests that you can ask for. I don't know. This is just my experience, and I think that documenting both of my miscarriages helped me work through my emotions and work through talking it out. I appreciate you watching till the end. I'm hoping to document more of this year with being pregnant on the blood thinner, being pregnant with a toddler, and just remembering this life that we get to live, and I'm just so thankful. And if you could subscribe, if you could like it, if you could share this video with someone that's gone through loss or something similar or has any questions about anything. I don't know that this could help them, but it could maybe help them feel less alone. But thank you so much for watching, and we'll see you in the next one. Bye.